This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and my client presents with symmetry throughout her pelvis and symmetry of mobility with passive motion testing, which I named them spring tests or spring recoil tests. Except there's one direction where motion is absent. Let's have you lie on your stomach, please. So she has good vertical mobility through each hemipelvis. She has good mobility through each side of her sacrum. She has good mobility with an anterior spring on the ischium on both sides. Let me double check the camera angle. Good, good. The sacrum has good inferior glide. It has good backward bending. It has good forward bending. The ilium has good lateral mobility. I also sprang each sacral quadrant when she was sitting, looking to see if there was a sacral torsion, and there was none. There was good mobility there. The top of the ilium rotates forward, glides inferiorly on each side, very good mobility throughout. And she even has good oblique mobility. And so now I'm going to show you where mobility is lost. Can you lie on your right side, please? Good. And put your legs out straight behind you, just a little bit. Good, good. And just stay sideways. And I'm going to double check the camera angle. So only when she's lying on her side do I discover where mobility is lacking. When I capture the posterior ilium and I load it and spring it, this feels excessive. When I come to the front of the pelvis, I capture the lateral part of the ilium, there is no give. There is no spring mobility going towards the floor. So it's as though your ilium rotated medially, posteromedially on the left. And that would be called a traditional outflare, which the osteopaths described long ago. They test it differently. I use the passive spring test. Lie on your other side, please. And on the right ilium, we have excessive movement in the front, going medially. And in the back, there is an absence of mobility. Okay? And the way that I treat it, lie on your back, please, is I place a piece of 2-inch foam on the anterolateral aspect of the left hemipelvis, and then lay on your side, please, on top of that. It's going to feel kind of strange. It's hard to balance on that device. Okay? We're going to leave you there for 5 minutes. And then I'll have you lie on your other side. Go ahead and roll over. And then to glide the right ilium posteromedially, then we tuck it under the ilium here and have you lay on that for 5 minutes.
Okay.
Okay? So I'm going to stop filming here and I'll set a timer for 5 minutes. We'll do each side and then we'll come back and film the response to treatment.